Good morning from Deuk Spine Institute here in Melbourne, Florida. I'm Dr. Deuk, CEO and founder, and we are going to be live streaming again, as we do every week, spine surgery. Our patient is from Israel. He presents to us with back and neck pain. We've already fixed his back pain with a Deuk laser disc repair at L4-5 last week. Today he has back pain above where we fixed at T12 to L2 on the right side. We believe it's facet joint pain. It's worse with extension, rotation. He had facet pain below that, which we fixed last week. He has no more pain where we did our surgery last week. However, he has pain above in his back, and he has pain in his neck. We're going to be doing the Deuk laser disc repair later today. But first, we're going to treat his facet joint pain, which is what's causing him the most pain in his back of his neck and the lower back. We're going to start with his neck. All right, I'm going to use the x-ray machine to navigate, get to where I need to go to treat the pain coming from the facet joints on the right side of his neck. We're going to make an incision, and if you have questions, feel free to ask. Today we have Lily, who is filling in for Henry. Henry is out hanging out with Bigfoot on vacation somewhere out in the forest. We don't know where, but he's out there in the great yonder, right? All right, you can see the tip of the probe is right over the target. The target is the edge of the facet. That's where the pain nerve, also known as the medial branch of the dorsal ramus, that pain nerve travels around the facet joint, around the lateral mass, and innervates the facet joint. It's the same target used for radiofrequency ablation. The difference is our procedure is a permanent radiofrequency ablation, whereas an RFA is temporary. Patients have to keep coming back and getting treatment. Our treatment is permanent. All right, any questions?
No questions at this time.
Then why don't you show the audience how facet joints cause neck pain, but also how we permanently eliminate that pain. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. All right, now you see there are 30 things that cause neck pain. And there are 30 different causes of back pain, and those causes are pretty much the same. Disc, facet. In the neck you can have a fracture, in the back you can have a fracture as well, but in the lower back you can have a few more causes. That includes the sacroiliac joint and the piriformis muscle. All right, let's take a look at how we cure facet pain in the neck. Sean?
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. So we've just shown you how we cure neck pain that comes from facet joints. Now we're going to work on his lower back. He's got both neck pain and back pain. 65% of patients with horrible back pain also have problems in their cervical spine. And he happens to be one of those people. He's got neck and back. Sean? We're in the process of treating the facet joints in his lower back right now. And let's show everybody how we treat lumbar facets. Sean?
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see how we treat facet joint pain in the lower back, just like we do in the neck. We target the medial branch of the dorsal ramus and destroy the pain nerve. It is literally a pain nerve. That's all it does, is bring pain up to your brain from your back or your neck. So destroying it permanently is what everybody that has facet pain really needs. And we pioneered this technology here at Deuk Spine. You can see the incision is just a few millimeters. It's about 4 millimeters long. And, you know, we're done. Now, we're going to fix his neck, his discs in his neck. So we're going to do the Deuk laser disc repair next. We'll see you back in a few minutes. Thanks for everybody. Good job.